Hello and welcome to It's a Code U, mental health support for those working in healthcare. This is a podcast created for healthcare employees to explore not only issues relating to mental and emotional health, but also unique challenges that those working in healthcare are faced with. Your hosts are Adina Tucker, a licensed clinical social worker with Dartmouth Health, and Jennifer Hinsey, an MSW also with Dartmouth Health. Hello and welcome to It's a Code U. For May and June, we are focusing on mental health awareness as May is Mental Health Awareness Month. And for this episode, we're going to be looking at the medication side of mental health. Joining us today is Casey Williams. Casey is a psychiatric nurse practitioner who has been specializing in psychiatry since 2016. She has worked in a number of different environments, from inpatient psychiatry, outpatient, medical psychiatry, and has practiced in treating individuals across the entire lifespan. She currently works on our DHBHS team doing medication management for our employees, and she also works on the Lebanon campus doing psychiatric consults in emergency medicine as well. And her specific clinical interest is ADHD. And we really appreciate you being here, Casey. This is an episode that we've wanted to do for a while, as I know that I have clients who question whether medication would be helpful. So
Thank you for
we're excited.
having me here. I'm super excited to talk about where medications lie and what questions people might have about starting medications or whether or not they should start medications. So thanks for letting me join this morning, Adina and Jen.
Well, it's great to have you with us. And you certainly do fill a very big role when it comes to all the different clients we work with. So it's great to have you. And how about we just start off with you telling us a little bit about your journey, what led you to become a psychiatric APRN, and what drew you specifically to work with healthcare employees?
That is an awesome question. So I started out as a nursing student. I've always been a very curious person, and I think I've always been someone that wonders about the unknown and I'm drawn to my curiosity and how I can help people usually. And I started as a nurse and then realized as a student that I was the only student who was not uncomfortable working in the state's psychiatric hospital. And that was interesting to me because my fellow peers were, I think, very apprehensive and uncertain in that particular clinical role. And there was a lot of unknowns. And I think people had a tendency as students to pull back within that specific environment. And it was quite the opposite for me. That's where I just felt most at home. And I felt it easy to talk with individuals there that were having acute mental health crises. So I pretty much immediately went into psychiatry after I graduated from my nursing program. And I remember a distinct time where I had two different job options. And I was really unsure which one I wanted to do. And one was medical surge nursing for geriatric population. And the other one was the state hospital for psychiatric inpatient care. And a friend of mine had gotten a resident position at the state hospital. And I remember I was very jealous that she got that job. And that really made me question whether or not medical nursing was where I should be. And I made the decision to practice and specialize in psychiatry. And ever since then, I've just really wanted to help people and help understand them in some of the ways that medicine has a hard time in identifying what people are going through because there's not that objective data that the rest of medicine relies on in terms of symptom management.
Yeah, it's always interesting to know what led people to, especially in helping professions, like what led people to their specific area. So, for people who aren't really sure about scheduling an appointment with someone for medication management, what are some reasons that someone might want to schedule an appointment with a psychiatric provider for medication management or evaluation?
Sure. There's a lot of different reasons people schedule medication appointments or even non medication appointments with a psychiatric provider. Usually, someone initially schedules because they're experiencing something new, something different, whether that be a feeling, an emotion, or a symptom, but something is ultimately bothersome to them. And sometimes they're on psychiatric medications and they're not working anymore. Sometimes individuals want to discuss what types of treatment there are or different things that they can try to help them feel better with whatever it is they're going through. Some specific examples why people might schedule are they might be having difficulties with sleep, they might be feeling depressed or low, maybe they're noticing that they're having a lot of mood swings or irritability that might be new, or oftentimes they're feeling anxious or uncertain. Sometimes these symptoms are not new for individuals and they've been happening for a long time, but sometimes people go through a major life change or there's some acute stressor that they are going through that has really impacted the way that they're feeling and impacting the way that they're functioning. But ultimately, most people that schedule are usually looking in some way to get some information or to better understand how they're feeling, whether or not things are going to get better. Do they need medications to feel better? Or what are the different options that they can consider to help them feel better or maybe function a little bit better than they have been? Most of the time, but not always, these appointments usually involve discussing medications if they're considered a recommendation for the person's specific symptoms, but they don't always need to focus on medications.
Great. So, can you speak to what sorts of misconceptions people often have about taking psychiatric medication and how maybe you see that play out in your work?
Yeah, there's there's a lot of different misconceptions like specific to just medications. Sometimes I think people are uncertain as to whether or not medications are warranted, or they might feel like there's stigma around medications, whether that's internal stigma or external stigma. There's a lot of different factors that go into how people perceive medications for mental health. And unfortunately, in our society, especially in healthcare, there is this implicit bias against the need to feel better and do better, and then a struggle on trying to do that as well. And people can be reluctant to take medications because it can make people feel like they're not good enough or they're not doing enough with what they already are trying to do. And that is, I think, just a known stigma that we have in society and within healthcare areas, which is unfortunate. But so besides that stigma existing, one of the things out there that can be difficult for people when they're considering medications is they feel when they are meeting with me that that's something that they have to do or that they might feel pressured to start and they might not be ready to start. So sometimes I think people don't ask about whether or not medications are needed or part of the picture because they might feel like they'll be forced into taking something that they're not ready to take. So there can be some reluctance about even asking about medications because of that fear. Also, people are sometimes unsure about what medications are going to do to their body too. A lot of psychiatric medications have some side effects that people are apprehensive about. So sometimes that can be a deterrent to people asking questions.
What are some things that people might not know about meeting with a psychiatric provider?
Sometimes people might not know whether or not medications are going to be something that they have to take. Sometimes people are unsure what we're going to talk about. They're unsure what the appointment is actually going to look like. they're uncertain about what level of detail of their past history and their symptoms that they're going to need to provide. Some people are unsure how to describe what they're going through, so they might not feel they have the ability to talk about some of their emotions, or even if they know what they're feeling, they might have difficulty opening up about some of their experiences because it can be very vulnerable and it can feel very painful sometimes to talk about things for the first time. I think as a society, we tend to bottle up our feelings, and instead of opening up and sharing how we're doing and sharing, some of the things that we might be struggling with or might be having a hard time with, we don't open up about it. So sometimes during appointments, people really they don't know how to approach talking about their symptoms. They don't know how to approach talking about what's going on. They are sometimes worried that they might be judged, or if they tell someone something that exists just out of their mind, it's the first time, and it might make what they're experiencing more real, and that's hard. And as psychiatric providers, I think we do a really good job in being able to ask specific questions to elicit information if someone has a hard time describing how they're feeling. And I think we do a really good job with not judging someone because of the things that they might have been through or might have experienced in their past. So I feel that our specialty as a psychiatric provider is really skilled at working with someone and helping the conversation feel comfortable with still trying to get to the same goal of helping somebody feel better. So sometimes people aren't aware, or they might not know that it's okay to talk about taboo topics, and letting us know all of the things that they feel or that they worry about empowers and enables us to help them more. Some people might not know that psychiatry has also changed a lot over the past 50 years. Meeting with a medication provider historically used to involve more like what we would consider couch therapy and in-depth psychoanalysis in addition to medication management. And that's something that people might not understand is a little bit different today too. So there might be some reluctance because people don't want to have in-depth conversations about past things that they've been through, because they don't want it to be examined or discussed on that type of level. And today we mostly focus on medication management and symptom management, and do some supportive psychotherapy within our appointments, but it's not as heavy as a focus as it used to be historically.
That's a great, that was a really great overview of what anybody out there listening who's never had a psychiatric medication appointment can get a gist of how it might flow and go. And I'm wondering too, can you expand on what someone could expect in their very first intake appointment for medication?
Sure. The intake appointment is what we consider a full psychiatric evaluation. So it's a longer appointment, and the time varies between different providers. Sometimes it's 90 minutes, most of the time it's 60 minutes. But we have a longer first appointment, and so we can really go over someone's chief concerns, their primary concerns, their reasons of scheduling, and as well as all of their past medical and psychiatric history. So during the first intake, I usually ask somebody what their goal of the visit for the day is, because that's where we really want to focus on. But there's so much to focus on, but that's the most important part. So usually people tell me they're coming to me because they have a specific reason or a specific goal in mind, whether that be treating a certain symptom or managing stress. So usually in the intake, we'll focus on what's going on right now. I'll ask them questions about when their bothersome symptoms started, how long they've been going on, different things that make their symptoms worse or better. I will also ask questions to understand how their life is currently being impacted socially, professionally, and also personally at home or within the family. I usually ask questions about other symptoms that they might not have. And that's to try to make sure that there's nothing else going on that maybe the person isn't necessarily worried about, but could also benefit from other sorts of treatment. Because oftentimes people have their primary concern, but there's a lot of other things too that they might not remember to bring up, or they might not feel is relevant or important. And sometimes those little other symptoms can be very important and there can be a lot of improvement for a lot of different things beyond just what the person is looking for. So I'll ask about a lot of other symptoms that they might or might not have. So I'll do a comprehensive psychiatric and medication evaluation as well, which includes all of their previous past psychiatric treatment. And that includes past medications, any past psychotherapy or supportive therapy, as well as their current medications, not just psychiatric medications, but medications they might be taking for other health related reasons. I will ask about family history, early life and development, as well as their past and current family structure. I ask a lot of questions about medical issues, surgeries, allergies, but I also ask questions that are not just medical or psychiatric as well. And I tend to ask some questions really focused on, the individual and trying to get to know them as a person better. Because underneath underneath symptoms, underneath health issues, there's somebody there, and that someone is really the person that I'm looking to help beyond just what there are for symptoms. Some of the questions that I will also ask is what religious or cultural preferences someone might have. I'll ask about any clinical preferences someone might have. As we discussed earlier, there is so much stigma surrounding mental health and mental health treatment. And for anybody that's coming to an initial psychiatric evaluation, it can feel very vulnerable. It can feel very uncomfortable to talk about oneself, like oneself, even when things are going well, let alone if things are not going well. And when there's an added layer of societal or personal stigma, just because we're all humans, that can make discussing these things even more difficult in these first appointments, especially with someone that you're meeting for the first time. I usually try to ask people, is there anything that you have liked or not liked about past care from past providers? Is there anything that you would like me to know about you as a person so that way I can take care of you in the way that you like to be taken care of? I I try to acknowledge that as a healthcare professional working in psychiatry, there is a lot of assessment, and in that leads to the potential for judgment. And it's important to recognize and open up the dialogue and conversation so that way nobody feels like they're being stigmatized. And that way people know that, or they understand that I don't want to make assumptions about someone, their past treatment, or their values. And I really welcome the opportunity to take care of them and how they want to be taken care of, however that looks. So that's one kind of unique question that I ask people during their intake that I don't think most people are usually asked. And most people have to think about it. And then I usually find out some really cool information that I would never find out when I ask that question. But I do also ask about other things which can be hard for people to talk about, like past difficult experiences or some things that people might have gone through before, in addition to substance use and different types of substances that people might use to either help with some of their symptoms or to make them feel better. So there's really so many different things that I will ask people. And depending on what they share with me or their comfort of what they would like to share and the information that they tell me, I might ask a lot of additional questions too. But the end goal for an appointment together, at least the first intake, is to really focus on the person's goal for scheduling. So, whatever it is they're looking for help with, we try to come up with options that they can consider to ultimately feel better.
I think that is just so wonderful too, because you're really helping them have options that are tailored to them as a person, right? And not just symptoms they're exhibiting, but all of these different pieces that make them a whole person that you mentioned that you take into consideration. So I just think that's wonderful. It's a wonderful way to treat folks and practice. So
It,
thank you.
yeah, you're welcome. It's really important to me that I not be a clinician that adds to an unfortunate journey in mental health or someone's experiences or a negative experience in healthcare. Because I think it happens so often when we're talking about how to feel better and how to feel well. We as clinicians have a tendency to pathologize things and pathologize symptoms. And that's different in behavioral health because we're talking about someone's emotional well being. We're talking about the way that someone connects with other people and opens up and shares. And that is very hard. And so it's a focus of mine to try to help people feel comfortable and whatever that comfort may be, whether it's a discussion, whether it's a medication, but to really meet them where they're at with their goals and with their own unique mental health journey and experiences before.
If you could speak to how you balance medication management with kind of that broader picture of someone's mental health, like therapy, sleep, or relationships, and those other things that kind of affect someone's mental health.
Yeah, that's a great question, Adina. And that's a topic that comes up quite a bit. There is, and this can really go one of two ways depending on on a patient's or a client's preference. But it is a balance with where medications lie and how they can help people, and also where the areas that medications might not be as helpful for certain things. And it's a careful discussion that I try to have with each person when we are managing medications, because there's some things that we know that medications do a really good job at helping, like symptoms of depression and symptoms of anxiety and difficulties with sleep. And sometimes there's also external factors that can really contribute to how someone functions and how someone feels or how someone manages their stress. Often there are factors that do contribute to how someone is maybe not functioning as well as they would like to be functioning, with that medications can help, but they don't help in the same way that other techniques can help, like psychotherapy or lifestyle modifications. So, whenever I'm talking about medications or managing a medication, I try to have a careful conversation with each person about what are the things that are contributing to symptoms? What are the different factors here that are making things better and making things worse? And sometimes medications help, and sometimes after having these conversations with individuals, they tell me, I really think it was getting out and going for a walk or changing my schedule or turning off the phone at night or meditation that really made the difference in addition to just the medication. So it's important to identify the different factors because there's improvement or room for improvement beyond just where medications can help.
Excellent. And right, sometimes even too leaving that relationship, right? Or cutting communication or distancing, all sorts of things. Yeah. Very good. Yeah.
Yeah, there's a lot of different factors and parts that go into our emotions and our feelings and how we show up each day, and that may be
Yeah.
different day to day. And I want to use medications when they help and when they can really improve how someone's feeling and functioning. And I also want to have a conversation about other things people can consider when there's wiggle room for adjustments elsewhere too, because there's sometimes like a little extra 10% of feeling better that can come from maybe less coffee each day, maybe turning off our cell phones, or maybe just getting a walk in the sun too.
Yeah, that's an excellent point. So I'm curious, what are some of the most common conditions that you help healthcare employees manage? And how does medication play a role in helping to stabilize them or support them?
That is a great question. So I don't think there's probably one specific thing because we have so many different roles within our healthcare system that have different that attract different types of people with different types of personalities. But I think some of the more common things that I do see are probably anxiety and depression and difficulties with managing work life balance. And that work life balance sometimes means juggling a lot of different hats and a lot of different roles. That can be leadership roles at work, it can be direct patient care at work, it can be difficulties with colleagues or trying to manage like interpersonal stress, and sometimes it can be all of that and then also trying to function as the head of the household at home while managing one's own mental well-being or the health of family members too. I think sometimes with this unique population of healthcare staff and hospital staff or clinic staff is there's often a lot of exposures to taking care of other people. And at the end of the day, it can make it really hard to prioritize taking care of ourselves, and whether that be like mood concerns or anxiety or frustration or irritability. But I think ultimately probably low mood and difficulties with managing work life balance and anxiety is probably what I see the most of.
I know that I've had several people who have been working on depression and anxiety, and they feel like it's just to the point where they can't really work on some of the therapeutic coping skills because it's just so high, and but they don't want to go on medications. That's a struggle that they're just like, well, I don't know if I should do it or not. So I'm just curious for anyone who might be listening who is struggling, but they're really unsure about whether or not medication could help. What's something that you would want that person to know?
Yeah, I think it's helpful whenever someone is really kind of like at their wits' end, or they're like baring their teeth and they're using their grit and they're getting through just barely, and they're trying to use all of their resources and the skills that have been successful and that have been helpful for them in the past, and it just seems barely enough. I would encourage someone going through that to ask the people around them that they trust and that they love and that they care about what they've noticed or what they've been through and what's been helpful for them in the past. I think sometimes talking about what someone's going through or what feelings that they have or their apprehension about medication, it can feel sometimes more comfortable, or it can be more welcoming to talk about that with somebody that you know and trust first. And sometimes the people around us can often give us feedback about things that they've noticed as well too, that someone might not even notice within themselves. So sometimes having a discussion with people around you can be helpful. And then I would encourage someone that's really kind of struggling or trying to get by day to day to go ahead and just schedule an appointment, and an appointment with any provider, but specifically, I can speak to my own practice, never has to include medication as the only option. It's really a conversation about what the options are and what options can be considered. And ultimately, at the end of that, the decision on whether or not someone wants to start medications or feels like they might be helpful are up to the person themselves, and having that initial conversation can be very helpful about understanding what the options even are.
That's that's really great information for folks listening who are struggling with deciding, do I want to pursue medication or not, and are just facing a lot of uncertainty around that. I think that's really, really excellent to hear it directly from the provider. So thank you. And I was wondering too, is there anything hopeful or encouraging that you've witnessed in your role that you think more people should hear about?
Yeah, that is a really great question. One of the things that I hear is people are often surprised at how easy things are once they find the right medication that works for them, or once they try to approach a problem in a different way that they hadn't considered before, even if it's not a medication. So my goal, obviously, for everybody is I just want you to feel better. I don't care what that looks like or how that is. I don't care what that means on paper from a diagnostic standpoint. And usually when we start focusing on feelings instead of like symptoms, and we start focusing on the areas of that could be better, and we explore medications, the the beautiful part of medications is when you find the right one that fits so magically within all of the other tools someone else is already using in their life to feel better. The balance that people find and the benefit that people find of whatever their struggles have been can become so much improved, and their functionality becomes so much more optimized, and they realize life is so much easier than how it had been before. And I didn't realize how much I was struggling or how hard I was working to feel the way that I felt, which wasn't that great. So I think even if it's not medications, just finding different ways that people can feel better and seeing them feel better is really like the most inspiring part of my job, and having those like conversations of with individuals where they tell me like things feel brighter, things feel less heavy, the sun feels like it's bright and shiny again, and they feel like they can really just breathe. So that's where I think like medications can be probably the most helpful. It's like the inching back towards people feeling the way that they used to feel.
I think that's a really good encouraging point for people that are really trying to white knuckle it, but it's not getting better and it's just so heavy, because I see a lot of that where they're just, maybe they had a bad experience with medication in the past, and so they're just like, well, I'm never again trying one, but they're really having a hard time. I think that's a really good thing for people to hear. And also there's new medications all the time. So
Yeah. Yeah. There's so many new medications. There's so many different approaches to helping someone feel better. And it's really important, I think, for people to know. And but it's hard to explain, or I guess, conceptualize that sometimes it's not the first medication. It can take a lot of trials, and that's tough. And that is, I think, where some people get discouraged with medications, is they've tried a few before and they haven't worked, or if they did work, they caused side effects. So people can feel frustrated and really deterred against trying different things. And sometimes it's specific providers too. We have different approaches, and there's not one straightforward approach to feeling better with psychiatric medications. And sometimes sometimes it's a clinical fit. So people just need to find the right provider, the right psychiatric provider, and sometimes they need to find the right psychiatric medication or combination of medications, which can be a little bit of a journey, and it's not a sprint. So it's hard, I think, for people that have been white knuckling it, that really want to feel better and they're looking for options. It can sometimes be a little discouraging to know that these things do unfortunately take time, but it's worthwhile, I think, if people are open to exploring medications and they can trust their clinician and speak openly about what they've been going through. So that way, medication decisions can be made mutually and can be made with the right information and the right discussions to try to find something that will work best for each person.
Casey, is there anything in your mind right now that you're like, oh, I wish they had asked me about this particular thing, so I would have loved to speak to it or anything like that?
Yeah, if I had one thing, or I guess one bit of advice that I could just throw out there to the universal world, or one particular person that might be listening, that might be questioning whether or not they want to meet with me or even meet with their primary care physician and discuss medications for mental health, I would want to tell that one person listening, or that one person who's curious or ambivalent, that I'm proud of them for listening. I'm proud of them for considering and thinking about how they feel. And if and when someone is ready to talk about medications or talk about how they can feel better, I would want them to know that I'm proud and happy that they're reaching out for help. It takes a lot of courage and strength to ask for help and to reach out. And it's important for people to know that, like, you're not alone in what you're going through. And asking for help or reaching out is ultimately the first step to feeling better. And it shows how much you care about yourself, and it shows how much you care and value your own well being. So it's important, I think, for people to know that just because you're going through something tough, it doesn't mean that you're broken. It doesn't mean that you need to be fixed. It doesn't mean that you aren't enough and that what you're doing isn't enough. No matter where you are in your mental health journey, you deserve to feel like yourself. You deserve compassion. You deserve to feel understood and heard. And if things are hard, I hope that you can give yourself the same kindness that you would give someone you care about and someone you love who might be struggling or having a hard time too. So if there's anyone out there that's having a hard time, I just want them to know that they're worth it and that I'm glad that they're showing up every day, even if it's hard.
Well, thank you, Casey, so much for being here. This has been super helpful. I feel like I'm even thinking of some of my own clients who've struggled with, should I try medication again? And I feel like this will be very reassuring for people who are maybe just afraid to make that appointment, that this is helpful information and it's your journey and you're in control of it. So I really appreciate you being here for this discussion. If you have not subscribed on your favorite listening platform, please do that. If you have any questions or comments or feedback, you can email us at dhbhs.media@hitchcock.org. And we thank you so much for listening.